Do you know what stabilizes your horse and what actually like moves your horse? So all this week we've been talking about back pain, and it's really important to understand those two different functions and what structures actually stabilize your horse and what structures move your horse. So a lot of times in back pain, we start to think about the large back muscles that get painful as being the problem, when a lot of times it can be the stabilizing muscles of the horse's spine that are really the problem. And the structures that go along with that help stabilize the entire body through these fascial lines. So I said in one of those videos that I was going to talk a little bit about actually what those structures were, and that's this video here. So let's talk about stabilizers. So one of those muscles is the multifidus muscle, and they are little muscles that literally go from vertebrae to vertebrae, and they don't have a lot of big movement in them. What they are to do is stabilize the movement of the vertebrae. So two other muscles that help the multifidus is the interspinalis and the intertransversary. That's a mouthful. And then you have the larger muscles that are used for movement. So those would be the paravertebrals, the longissimus dorsi muscles, and they're the ones that you usually feel that get tight when the horse has back pain. And a lot of times they'll tighten, they'll hollow the horse's back, and sometimes they're trying to stabilize a painful back, but that is not what they should be doing. So if they're doing that, then that's sort of an indication that there's a problem. Of course, another piece of this is the abdominals. So they're part of the core, just like we think of ourselves. And so they are also part of the horse's core, and development of them can supplementally help these smaller muscles to stabilize the spine. You also have the thoracic sling muscles, and the thoracic sling, which has to do with fascia and not just muscles and connective tissue. And that helps hold the rib cage in between the shoulder blades. And basically this helps hold the trunk up, and is a really important function in horses for collection. And of course, part of that whole chain and system is the gluteals and the pelvic muscles and the sacroiliac region, because they stabilize the pelvis so that the thrust of the hind leg actually comes up through the pelvis and through the spine. So the big takeaway here is it's not just one muscle or one thing that stabilizes the spine when you have back pain and you are questioning whether it's working well. It's a whole system. And when that system isn't working properly, you can get back pain. And this literally is what holistic medicine is.